Welcome to this week's episode of 3,600 Seconds with Industry Leaders on LinkedIn Live. We are still celebrating every African woman in this International Women's Month. Of course, I'm your host for today, Miss Abi, and we are quite glad to have Princess Ndupu all the way from Texas, United States of America, joining us today. Princess is a mission driven leader. She's been working at the intersection of heritage, health, and genomic equity. She's also the founder and executive director of AfriGenetry Link, right? That's
Yeah.
AfriGenetry Link. Just like we've already told you from times past when we were advertising this particular program. AfriGenetry Link is a global non-profit that is dedicated to reconnecting Africans and the African diaspora with their ancestry while advancing preventive genetic health awareness in Black communities. Well, with a background in environmental biology and an MBA in IT management, Princess has worked across multiple sectors, including the Florida Department of Health, healthcare, and the financial services industry, guided by a deep passion for public health and community development empowerment. She is now leading innovative initiatives like the Gen Africa program, which brings DNA education, community health outreach, and identity restoration to communities across Africa and the diaspora. Our work indeed is helping shape the future where African heritage, health, knowledge, and healing come together to empower generations. That's the kind of person we have today in the house. So join me, everyone, as we welcome Princess to today's show. It's great to have you live with us today, Princess. You're welcome.
Thank you so much. Thank you for having me.
All right. So, dear viewers, Princess and I will be exploring the topic you can see boldly displayed on the screen right now. Women leading the future of heritage and health in Africa and diaspora. Without any further ado, let's get down to the business of the 3,600 seconds of the day. All right. So, Princess, you are a woman leader in the African diaspora, a renowned one as that, doing Africa proud. So, as a leader in the African diaspora, what's your vision for breeding heritage in Africa and globally?
Thank you so much for that question. So when it comes to my vision, I see a vision, where heritage, health, healing are no longer treated as separate conversations. They are treated as one conversation. Because I believe that when people discover their ancestors or where their ancestors came from, it often opens the door to deeper questions about family history, culture, and even inherited diseases that people don't really talk about. We have inherited patterns. So by connecting ancestry knowledge with genetic health education, we can help communities understand both who they are, where they came from, how to protect their future health. And that's what we are building through AfriGenetry Link, building programs that bring together Africans both on the continent and the diaspora to learn from each other and share knowledge, improve health outcomes. So understanding where we come from does not only help us, it helps us protect where we are going. So that's the future I see.
Awesome, awesome. That's a noble initiative indeed. And really thank you for taking it up. A task that very few persons are able to talk about. No one should be displaced at a time like this, especially as Africans who
Yeah.
know our history. So, would you say women are the keepers of family health? For you to take this bold step.
Uh, this question, I know that men may come for me, but if I have to say, I will start with saying that women are keepers of family health. Why? Because women remember family health history. Our mothers,
Mm,
grandmothers, hold the stories. I will not say that men don't hold stories. They do. But when we talk about heart to heart talk, we talk about women. Let's just take a look. In many African homes or settings, if you want to know family health history, you ask the mother or grandmother. For example, if an African mother is scolding you or screaming on something, you will hear them say, your uncle had high blood pressure. Your aunts, had diabetes. You know that this person died of this and died of that, and they're still taking salt. They took salt. They're just coding you. The problem is they don't really, connect or understand what they are saying. They're just telling you based on what they thought they should tell you to understand that you need to do right. You need to act a certain way. That's African mothers for you, African grandmothers for you. So, but when it comes to that, they don't sometimes as women, we talk about it, but we don't connect those stories to genetic risk prevention or genetic risk disease. We don't do that. Even when we are screaming it or talking about it, we don't connect the dot. But I believe that once, informal knowledge becomes formal, once women understand that those family stories, those family um, uh, health histories, are actually health signals. They begin to advocate for early screening and prevention. They begin to, have that heart-to-heart talk in a different understanding because women already hold the knowledge. But when we talk about DNA education or how they can, emphasize more on family health history, it turns to stories. It turns those stories into health insight, and it helps them interpret it more and better understand it, which can help the future, protect the future generation to come.
that's true. I agree with you. In fact, African mothers in particular, I don't know if I should say they should repent. Because even if you don't ask them, they are very fond of African
Yes,
mothers. Do you know that they, even if they are 50 or 60 years old, they will remind you how much you weighed when you were born. So
exactly.
even
They really are keepers.
that is just much. A friend of mine, it was quite hilarious. I overheard his mother telling me somebody that is like a grown man, a full grown man. His mother was telling him that the smell of his food when he was a baby is still there in her finger. And she still remember how it smelled. Can you imagine?
Yeah,
This women are
mothers and grandmothers are they are really keepers because
mm,
once they capture something, they want the future generation to know about that. But
mm,
sometimes, I mean, both men and female, all their kids. But majority of the time, you see that what men do is to tell the men because they believe men will stay and girls will go.
mm.
But mothers don't do that. They keep all the information and they share it with both of their kids. But if it's a girl or a boy, they don't care. So that's what makes the difference.
Indeed. I agree with you. I agree with you. So, good a thing today we are talking about genomic health, and I'm very sure our viewers have a lot to learn. They really have a lot to learn. It's not just about me reminding you how your mothers can tell you your history, your grandmothers can tell you your history, your general physical history. But once we go down into something very crucial, every one of us should take serious. So, talking about the future of genomic health, how are women shaping or leading it?
I so much love this because I will start by saying that in the last past 5 years, Africa have moved from a place of not knowing anything about genomic health to a place where we are now. We have, so many researchers. We have a lot of things going on in genomic sector space, and that makes me so much happy in Africa. Um, and when you look at it, you see that women are leading in those research. Not that men are not, but I'm just happy
Mm,
seeing women shaping the future of genomic health through research, through non-profit, creating non-profit, trying to impact the world, trying to impact Africa because we are still behind, but we are not where we used to be 5 years ago. So a lot has happened, a lot has changed. And when we talk about it, also remember that women are caregivers, naturally
mm,
caregivers.
mm.
We have
Very
talked
true.
about how women share, health informations. We just talked about it. They are keepers. And because of that, indirectly, they educate families. And those are ways outside, the people in the lab, the people in schools, and people doing a lot of things in different sectors. Our mothers as well, that are caregivers, are also shaping genomic health. And that's why when you come to go to many families, especially in African families, you see that women are the ones, scheduling doctor's appointments, reminding everyone about medication. Because they are always physically present with the kids, including their husbands. So they remind them, take your medication, take this, take that, do this, do that, eat healthy, make health decisions for their children. So when women gain access to genetic knowledge, it multiplies. We are multipliers. And
Mm,
because as we are changing the narrative of genomic health in Africa and in Black communities as a large, it's going to multiply because that's who we are naturally. We are multipliers. It spreads through the families, it spreads across generations, it spreads across nations. So empowering one woman can transform the entire generation. And that's, the more we are shaping the future, the more we are shaping what is going on in genomic health. I also encourage more women, to venture into this aspect of genomic health. And when we talk
mm,
about genomic health, we talk about, living free, living free life in just a human understanding. Genomic is more of our genes, and when we deal with our genes, there's something we call epigenetic. It's something that separates us from lifestyle. So that it runs in your family doesn't mean that it's you. Even though you have that risk, doesn't mean that you should have that disease. There is something else
mm.
to do when it comes to lifestyle. And we are going there. And the women that we have now are really shaping the genomic world.
Wow, fantastic, fantastic. Updates like this gladden the heart so much, and it's a thing of pride to see women leading in fields like this. These are not so well known. I believe in some parts of Africa, some countries in Africa, most of our higher institutions are yet to really imbibe this in some of their medical related um, departments, faculties. So it is not so common. But well, we learn every day. We learn every day. And I also want to believe that the education reformers in various countries across the continents, across our African continent, key in on this, and do the needful. See how they can carry out deep overhauling in their medical sciences uh, faculties or the various institutions that promote the learning of medical sciences, and see how genomic health can be properly practiced. We really need it. I think that particular field of study is more crucial to us in
Oh
for
yeah,
obvious
yes, it does.
reasons. Yes. So, Princess, as a female founder of AfriGenetry Link, work in the heritage and genomic health space, do you believe connecting with ancestry is powerful for African and Black women? No, we are being specific on the women this time. It's our month. Okay. Men should not be jealous. We'll come to them when it's their own month. So, so do you believe for us to connect with ancestry is a powerful move for African women, for Black women in general? And if you believe, how is Afri-Geometry Link helping women lead change in their families and their communities?
Yeah, thank you so much. This is a sensitive topic because when it comes to ancestry, people run away from, especially sometimes women do run away from ancestry, and you can't blame them because ancestry sometimes comes with emotions, comes with deeper understanding of knowing who you are, where you, and in the part of especially Africa, when you talk about DNA, a lot of women raise an eyebrow. They don't do that because they don't want their kids to know who they are or where they came from. They do that because of so many factors: fear, trauma, shame, preservation. If they know the truth, what is going to happen? Maybe I will be kicked out of my husband's house. This may happen, this may happen. But also, if they know the truth, do we think something positive may happen too? It's not only negative things that may happen, something positive may happen to the faith as well. And when it comes to ancestral DNA is not only, for us as women. When we know that when we discover or help generations discover their ancestry, that moment goes even deeper because women carry stories. We have said it. We are storytellers. We are keepers. We connect. We don't only reconnect just one person. We connect the entire generation, and it becomes more than geography, or it becomes identity, dignity, and healing. And what we own our keys is to tell them who they are. That's what, despite if they want to connect with whoever they want to connect with, but we owe them that truth. And owing them that truth makes us heal, healing. Because so many people wants to say it, but because of the shame of the community, because of shame of the society, it seems the little mistake I made has cost me this. So it's better I don't speak up till I die because I don't want to be in that situation. I totally understand that. But sometimes when you look at your kids and there's something that happened in this organization, part of one of us, had a disease that lived for so many years. And she kept managing it until she said, no, I need to go and see the doctor. She went. The doctor said it's maybe a genetical issue, meaning it runs in your bloodline, right? So go ask your family
Yeah.
members, ask everybody, and know. And this lady, she's part of AfriGenetry Link. She went, asked the mom, asked the dad, everybody, and they said, we don't have this. She left it that way, but she's a health coach. The thing kept multiplying that she needed an answer. And she said, there's something not really sitting right with me. Somebody in this family should have had it, or am I the only person that just developed it? She now
Mm.
went to do her ancestry, and that was when she realized that both mother and father is not biologically related to her.
Wow. Was she
And it shocked
adopted?
me. Yes, she was. I will not, she was adopted, but not like registered adoption. So it's just a messy story.
Oh, I see.
And we owe our kids the truth, whether adopted or not. If even if the
Mm.
kids are adopted, you are an angel in their life.
Mm-hmm. Very
And
true.
you need to tell them the truth. That doesn't mean you are not their parents. You are, and you will remain their parent. But if there is something that needs to be done biologically when it comes to health problem or health wise, then that's when they will start asking you questions, just in this kind of case. So in the process of connecting with her ancestry, that was when she was able to see her family. There was a match. She met her dad and saw that her dad has been passing through that for years.
Mm.
And they started telling her how they used to manage it in the family, this and that. And her being a health coach came with her own ideas, and that was how they blended it. She helped the dad helped her. It has been something that runs in the family, like a ritual, and they have this just the way they manage it. And that was why this lady joined AfriGenetry Link, because she said a lot of people needs to know this truth.
Indeed.
So this
Indeed.
lady has
Indeed.
been through for so many years without no help, or just health connected her to ancestry, and ancestry connected her back to health, and the healing came. So that's
Indeed.
why we need to connect to our ancestry, because there are so many things that comes with it. Here in AfriGentry Link, we believe that every child needs to know who they are, everybody, where they came from, and what runs in their bloodline. And we are building a system where women can become leaders in both heritage awareness and preventive health. Through programs like in Africa, where we are bringing free DNA tests, both ancestry tests and genetic tests to Africa. And it's going to, be mind blowing, because we are going to come with education as well, not only free DNA test, but education that can, create awareness. And here as well in AfriGentry Link, we are trying to build women. How are we building women? If you come to Africa, you know that there is so much gap, when it comes to genetic counselors.
Indeed.
In
Indeed.
you know, there are things you don't need to rush to the hospital for. You don't even need to see genetic counselor because you are sick. You don't need to be sick to see. And we need genetic counselors in communities, in our community health centers, in universities, in sickle cell centers. Because sometimes a lot of our health professionals don't know more about, how to counsel people when it comes to genomic disease or genetic diseases. So we need all these people to counsel people about diabetes, hypertension, all these inherited diseases that kills more than anything. And that's why when to empower women, we have something we are coming up with called Genetry Fellowship, where we are training genetic counselors. So it's going to be a 1 year program. That 1 year program, we are going to deploy them to community health centers, where they will communicate the language in a way, in native languages where people can understand. So we are going to take African women, we're also taking African men, but in health sectors, meaning you must be in health sector, maybe a nurse, a public health officer, whatever, to be part of this program. So it's going to be limited, because we are starting first, but we want to deploy them and also pay them still paid. It's going to be free. They are going to cancel our communities. So if maybe you are out there, you are community health centers, or community health centers that would like to benefit from this, hospitals, those health centers, then they can reach out to us, and we can partner with them and deploy, these women and men out there that will help impart and counsel, educate our families and our communities.
Indeed. You see, the story you just gave to us now, the story you just told us is really touching, and it reminds me of so many things. But first of all, I just want to tell you that I agree with you on that aspect. Every child deserves to know who they are, and parents owe their children the truth about themselves, as in the entire truth, if possible, not just who their forefathers were. Because if there's any issue running through the family, um, even if it is not genetic, if somebody have had one or two health issues in the past, let them know, because we
Yeah.
never can tell. I think way back in secondary school biology, I think they used to teach us about recessive genes, dominant and recessive genes, and all that. The recessive genes in particular, it will be funny when they come back.
Yeah.
You don't know which particular child to touch on. So even if that child is not yours biologically, that child is supposed to know the truth. The stage the child will grow to, let the child know. Maybe as long as you not steal the child from the hospital, you're not among those who connively supposed to steal other things in the clinic. If you adopted that child, maybe the child was born somewhere by touch time, like what we keep hearing about lately, and you have mercy to the child in and to him or her. Let that child know as time goes by. It doesn't change anything. I believe strongly that children belong to those who love them and raise them, not necessarily to those who gave birth to them. So we owe ourselves that. And talking about the as of these genetic issues, like in my case, there was a time I was really down. I got to know
Mm.
that granuts really good in my system. I had to stop eating granuts immediately. Carried out the thorough search and discovered that it's more like a bloodline thing. I had to relay this particular experience to a few family members of mine, and they discovered that truly granite doesn't work well in our system.
Yeah.
So
Of
it
course.
affected allergy. Even the children born into the family, they are experiencing that. Like granite seems to trigger something in your system. And if you
Hmm.
keep eating of granules, it could go there and make your immune system make it so wild that to be encouraging some inflammatory diseases, like osteo-related issues, particularly where the bones are concerned. So we have to put this stop. And ever since I left Granot alone, I can say I'm living happily ever.
Exactly, Lex. There are so many things that runs in so many families, and if you are not, even if you live in that family and you're not part of that family, biologically, you will be doing the exact thing they do. I remember someone that came, the first person that joined, volunteered for AfriGenetry Link, came as because um, she needed and because so many confusion because of health issues as well. So we we helped her, and after she saw the dad, she came with this testimony and said, "Wow, that she was a veteran because she was passing through so many diseases here and there. There's no week that passed without her getting no sick. You know, she ate well, everything. She was, she was not even eating meat. And all of a sudden, happened for her, got her DNA ancestry test done, and met family. And it was wine first with her mouth and said, "Wow, Dad, what they eat in her family, I mean biological family, this is a woman that should be around 60 something years old."
Mm,
Uh, was 89 at that time. Then that was good things, how siblings started telling her about how the family the dynamic is, what they eat. and what they don't eat. What they don't eat is what she has been eating.
Wow.
And
Imagine.
she came to tell me as a testimony that she started eating, left all the things she had eaten before parent by now, started eating what they ate, what they told her, how they used to prepare it, all those things. And there has been a change. I was looking at her like, are you serious? She said, it
Serious.
changed. She was all over the place. She was so thrilled. She was happy. You can feel the joy in. She said, wow, wow, wow. Just just a slight change. That changed so many things in her life. And that's what we do. Just that maybe yes or no or this or that can change a lot of things without us. So yeah.
Indeed, indeed. We are still on our dear viewers as about the conversation that is going on. And if you have questions, you have comments, you know how to do it. You can leave them in the chat box. And even if you're not able to take them because we still have a lot to talk about. This is a very crucial topic. Indeed. So even if you're not able to attend your questions, um, you can still get an answer because Princess is on LinkedIn. You know, this is a LinkedIn, right? So she is on LinkedIn. You can always approach her with your personal questions. But for today, I will advise you just sit still and learn. This is not a regular topic. Okay, so just sit still and learn. Okay, your questions, if we are there, if we have enough time, we'll attend to them. Thank you. So, Princess, why is genetic awareness particularly important for African and Black women?
Hmm. I would say this is just an extension of the conversation we just talked about last question. So when we talk about Africa and we talk about especially Black women, we talk about breast cancer, right? We just lost someone to stomach cancer just 2 weeks ago. This lady, I thought she was the first person that developed the stomach cancer, but just talking to
Oh
someone,
no.
the person said in that family died of some disease. I was serious. This lady died of stomach cancer, and 3 people in their lineage has already died of stomach cancer. And me was the person is our family friend. What are we doing about it? Who is the next person to die until we realize that genetic awareness is important?
Hmm.
Black women or women in general. When we see that we see our maybe our loved ones die of cancer, die of hypertension. I spoke with a woman who told me that had hypertension. Her aunt had diabetes. Her grandmother died young. And I asked, what did she died of? Said cancer, breast cancer. And she told about this
Ah.
pattern dance can affect her, but she was laughing. She got emotional and started laughing and said, God forbid, God forbid, it's not going to happen to me. Problem is sometimes we spiritualize things we should educate ourselves on and choose a different pattern and start. That is how to awareness is important. When we're losing our awareness to diseases that we can prevent just by doing certain things and just by even being aware of it. A lot of people don't even know what runs in their families. They don't. It's not a conversation we have so many conversations, we have so many patterns, and sometimes those patterns say they are spiritual problems. I'm not saying we don't have spiritual issues here and there, but we need to know and look back to look at our families, grandfather, grandmother, and all those things. Look beyond our father and even our grandfather. Look our uncles, look at our cousins, relatives. Know if it's a pattern that we need to break. Now, is it a health circle pattern or a spiritual pattern? Because sometimes what we call spiritual patterns are actually health patterns. And someone, the way we break spiritual patterns is the way we break health patterns. Breaking cycles comes with someone in that family saying enough is enough. And what makes genetic awareness more important is if someone died at the age of maybe 50, I've seen one that came and said he got, you know, his own problem. His own problem started at the age of, is it 45? And now his son is having the same problem at the age of 23. He said the doctor warned him that the son is not even talking to him because he didn't inform the son about this. So the guy was living careless life and everything, and all of a sudden the sickness erupted and he got sick so early because he did not tell him on time. And this is the pattern we have in Africa and in Black community as a whole, where we see health patterns, breast cancer, high blood pressure, diabetes, killing our fathers, killing our mothers. We kept crying about it. What many people don't realize is that non-communicable diseases, we talk about malaria, we talk about communicable diseases, but non-communicable diseases like sickle cell anemia, hypertension, diabetes, cancer, even heart disease, you know, are now responsible for a part of death globally in Africa. Not even in Africa, globally as well, because according to WHO, they say that non-communicable diseases killed about 43 million people worldwide in
Wow.
2021 alone. That's reporting 75% of all deaths globally. That's
That's so.
number
So.
2026 now. 43 million. And diseases, we don't talk about it because but it runs in genes. A lot of them runs in our bloodline. And because it runs in your bloodline doesn't mean you will have it, but it means there are things to do. So often, genetic awareness are really about taking prevention or very seriously. And that's why when I talk about women understanding patterns, families, certain cancers, also talking about what runs in our families is very important. And that's why when I talk about having genetic cancer loss, because we have a gap in Africa, is so dear to me. Because when we have genetic cancer loss, when we talk about genetic awareness, for me, it starts with awareness. Awareness moves to education. And from education, we talk about screening. And from screening, we talk about your lifestyle, changing your lifestyle. Infrastructure has been there, resources, financial resources, and all those things still there. But you see this for awareness, education, screening, and lifestyle, genetic counselors can fill that gap. They can create the awareness, they can educate you, counsel you, they can advise you to go for one screening or the other, and even how to manage those diseases if you already have it through lifestyle. And even if you don't have it, through lifestyle, just to prevent it. So I believe that when men understand genetic risk, they protect generations. So that's what I would say. That we need to protect ourselves, our future, and our children, just the future generation by this awareness. if I created a little bit of awareness about genetic, disease in those are I've said so far.
This felt to be honest. Women, I know we like spirituality because African women are spiritual. They have a different sense of spirituality than the men. And let us not spiritualize our health, please. Please. I think, okay, for those in the Christian community, even the Christ said those who are sick need a physician. And he's a miracle worker. He was a miracle worker and he still is a miracle worker. Like he said, those who are sick need a physician. Was he a
Exactly.
left? There's some things that common sense should know, let us know. God did not
Exactly.
create us.
Even the dog, even we pray about everything and we should pray about everything. But when you are praying, as I said, common sense it tells us to what to do and when to do it. You are praying
Mhm.
that medication will work, but you need to take medication for it to work, prayer to work. That's what I usually say. Someone was singing praise and worship in church, and all of a sudden, she slumped.
Mm.
And
Too bad.
everybody, the church, everybody started saying, pray, pray, pray. They started praying, the lady died.
The clinic.
Before she was rushed to the hospital, she died because
Oh,
nobody was able to do, first aid, few other things in there. And this woman had anemia.
oh no. Oh no. Oh
Yes.
no.
So these are knowing when to step out and knowing how when to, our prayers, keep our prayers is very important because there are things God will not do for you. You have to play your part, and God is definitely going to play His part. He's all
Yeah.
sufficient. He will do His part and allow you to do your own part. And your own part is when you are praying to Him. I usually give this instance. I said, um, in the Bible, Peter, was in a prison, right? And then the church gathered, they kept praying, Peter, come out, Peter, come out. When Peter came, started knocking on the door, they refused to open. They were not ready. Even when they opened the door and this girl said it's Peter, they said close, it's not Peter. But you were praying for Peter to be out. You pray. They closed, shut the door on him and said, no, 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 no. This guy kept knocking. Sometimes, and,
You see,
and
you see,
that's
these
happens to us
are
too.
good.
We are praying for something God is expecting us to just open the door, allow him in, do the right thing, and we don't. So, but it is, I think this is just a way to encourage us to the right thing to do. Just as I'm talking to you now, call your mom, call your dad, call anybody in your family, ask them, I want to learn our family history. It's very
Indeed, indeed, it is. In fact, for those of us who are always fond of saying it's not my portion, it's not my portion, whose portion is it? Please, today, from today, if you are listening in on this particular conversation, do the right thing. Be a responsible Christian or be a responsible spiritual person. Whatever spirituality you claim you are affiliated with. Okay, please be responsible. So that is just the thing that we need to do. And a matter of fact, the fact that we have a sense of spirituality does not take away autonomy from us as humans. We have the freedom, just as we have the freedom to choose what to eat that can nourish us and what to eat that can kill us. That is how it is with our lifestyles too. Most of need to change our lifestyle not to be okay. Let's have this sexuality and come to something else. All right, so Princess, how can African women begin taking control of their health using genetic and heritage knowledge? Now that we have successfully delivered them from the spirits of it's not my portion, and so how can they start taking control of their health? Start using genetic and heritage knowledge.
All right. Just to throw more emphasis on this as well, because we have talked about it. Someone will say, "What do I do?" As I said, just first learn family health history. If you're a mother, tell your kids what you know, and because we don't have a lot of people don't have their third generation here on earth now. It's a we can't wake them up from death. So take that advantage now for people that are alive, or even ask questions to know what they died of, right? The same thing. I lost my roommate's dad. My roommate lost the dad to pancreatic cancer that runs in their family. And the pattern of it was it took an Indian doctor to come to Nigeria to tell them what is wrong with this man. This man has been sick for 7 years. This kind of sickness, he will go to the hospital. They said it's malaria. Once in a while, he goes to the hospital, right? The hassle of going to the hospital, and it will be okay. They'll give him malaria medication, this and that, and everything was fine until it was a hustle. It was too much. It became so bad that they rushed him to the hospital. He was unconscious. That's after 7 years. That was when, a doctor came. They said that was when they diagnosed him with, cancer, stage 4, and this and that. And because it was too late, it was unfortunately too late. That was when the doctor from India came and said, this sometimes runs in the family. We want to check if anyone in the family has this. And the man said with his last stride, no. So because the man was a little bit not stable, the doctor asked the case, they said no, nobody. You can't blame them because nobody knows. Nobody knows about the family health history. And they don't even know there was a pattern that they need to break. They had to, the doctor pressure them to ask questions, ask, learn it, learn, ask. And that was when they started asking. I saw that two of their uncles that died of the same symptoms. And they said, back then, they said it was a spiritual problem. That was when they realized, their eyes opened, that this that they didn't die of spiritual problem. It was really cancer that killed them. And it was an eye opener. I can't forget what my roommate said. She said, I wish we knew on time. That's what she said. And that hit me so bad. Because if they knew, they would have done something different. 7 years, maybe he wouldn't have died. But unfortunately, he died. So we need to learn our family health history. We need to ask questions about hereditary conditions. If you want to know the kind of questions to ask, I'm here to help. I have a book that I wrote that I can help give out to you for free for now. On how you can even start a conversation, how you can ask questions. And also in screening, self-medication. We use self-medication a lot when you have something like a pattern and treated yourself self-medication for so long, please, you need to see the doctor. That's why I said some of the things, seeing the doctor, you need to see maybe a genetic counselor to help you, then for you to go and see the doctor to know, do you really want to see doctor? And also join health education programs like this. It's important. So if you're doing this, it means you want to improve your health, you want to improve family health, you want to be that person to break the health circle pattern in your family. Advocate for prevention. Many women know the family stories. As I said, multipliers, we are caregivers. They know who was sick, they know who struggled with certain conditions, and they don't just realize that stories contain health signals. So the first step is, documenting the health history, recognizing that those stories carry health signals. And when women begin asking the right questions, seeking knowledge, they become more powerful advocates for prevention for disease. Know that can become family stories can become, I'll say it again, family stories can become a tool for prevention. Just know that.
More things are coming up, and I wouldn't say they're scary. We're not saying this to make anybody scared. Okay, we're not having this session for anybody to be afraid. What you don't know, kill you. It can kill you. Yes, it can. That's why they say knowledge is power. So by virtue of this knowledge you are acquiring today, please try to do the needful. Act fast. Get to know what's really going on in the family, and as a woman, make sure you pass it down. Store it, store this knowledge and pass it down to whoever, whether your children or your kinsmen's children. All right. So, Princess, let's progress. What role do you see technology play in preserving African heritage and improving outcomes? This is the IT age. So
Yeah.
we can't afford to be behind our contemporaries. So what can technology do for us? What role can it play as far as this is concerned?
For me, technology is everything. We're in the world of, AI, and it means that in the next 4, 5 years, 6 years, I don't know, maybe we'll be flying. And all these things you have mentioned, preventive tools, everything outside education, everything in technology. Um, the equipment doctors use, everything are technology based. And we talk about infrastructure in our medical systems and everything. It's still infrastructure. It's just technology. We're looking for technology, and what was to be implemented back in Africa. So when we talk about technology, we talk about a transformative tool, that helps us understand both heritage and health. DNA tests allows people to, trace their ancestry across continents and reconnect with communities. I Technology is wonderful because you see a lot of people a lot of women that will say a lot. This is, the father of my baby. When DNA comes out, become a different father, right? They vow, and maybe sometimes it's just one night stand. I have seen one man. I was watching a documentary, and when they brought the picture of this guy, that woman hours to find that man, and she said it was just one night stand. There is no way in this life, if not technology, that this would have been done. Talk about ancestry, DNA technology reconnect ancestry, digital storytelling. Digital platforms, enable preservation and cultural stories. I love technology so much because when technology is used ethically and responsibly, it becomes the bridge connecting history, identity, and health. And that's why, at AfriGentry Link, we are also exploring this through the development of what we call triple H. Triple H meaning health, heritage, and healing, is an AI-powered digital space that we are going to design to, bring heritage, health, and healing into the science space. The goal is to help individuals understand their ancestry, learn about their health, potential genetic health risks, how to prevent it, even prevention, all in one place. And it's going to be out. We are going out with the MVP, which is going to be on WhatsApp. So if you want to be part of people that will benefit when the MVP is out using WhatsApp, then you can let us reach out to you and you let us know so you can be a part of this wonderful technology triple edge app that will be coming because digital scale we need the world is going in a place where without technology we can't do anything. And as women also encourage you, AI is booming. Take advantage of it. Learn, do training, a lot of places to learn. There are so many websites out there, free training, free courses. Take advantage of it. But know that technology can connect our past while protecting the.
Indeed, indeed. In fact, you just gingered me to take my AI lessons seriously. I love learning. I love learning. I learn for a living. But
Yeah,
sometimes,
I'm just trying to learn more. When you talk about technology, is something that can outdate you or outgrown you, so you need to pursue it. If I have to be honest, you need to pursue why it's growing. You need to grow with technology.
I agree. I agree. Initially, I was biased when the AI came, and I was feel biased. What will happen to natural intelligence? I'm still weary of loss of natural intelligence. I don't joke with natural intelligence. I later got to understand it's not really that bad. It depends on how it's being used. Because as humans, when we approach it with the engineering mindset, we become dependent on it, lose our intelligence. But when we look at it from the angle of an architect, we are human architects. We are meant to tell them what to do and not the other way around. We are meant to think
Yeah, correct.
and allow it or make it run errands for us. It should be like our messenger. You can't send somebody on an errand and the person will read your mind. You have to tell the person what the person wants to deliver for you, to get for you. So that's also works in my mind. Just because it's, I don't know why in my history I've never been so lazy to learn anything. Like my approach to AI.
No, please, I encourage you today. I'm encouraging myself to encouraging every woman out there
Yeah,
um,
well,
to take it serious. Even if you can share your knowledge with others and the resources, especially AI, and free, so AI can give you good. So
oh,
take it serious.
all right, all right. Okay, so what is one key challenge oriented initiatives facing Africa, and how can it be overcome?
Um, I would say one of the biggest challenges women-led initiatives face is access to resources and visibility. When we talk
I,
about resources, about limited funding, structural barriers, lack of representation in science, need for stronger partnership, and a lot of resources and there and visibility. And I can assure you that women are doing incredible work in communities. But this lack of funding and institutional support is a problem. Overcoming it requires stronger partnership between government, institutions, global organizations that believe in investing in women lives. But just know that even though we are facing, all these problems, don't keeping on, don't allow anything to distract you, just be focused. If you know that your initiative, whatever you are doing is something that will impact the world, change the world, uh, allow any challenge, uh, any challenge to convince you of who you are or what you want to contribute to your society. Just know that when women receive support, that's what I would try. Communities to receive transformation of
so you see, the challenges are the same everywhere you go. Access to funding, support, and the likes. Meanwhile, these women have a lot of ideas and systems
a lot.
to change the world. Sometimes the change we're looking for lies in that particular item. You are indirectly destroying life. want some valid changes to be done, don't sleep on this idea. We have a lot of women-led initiatives. Some of them even die in natural deaths, not because they lack systems or the ideas about it. Mental health is a united. So it's very important. An initiative like this, like the
Yeah.
initiative that is being launched by AfriGenetry, this organization. Remember that these things are really, really cost effective. They require funding. So as long as an organization, a non-profit organization, if it helps the public, however you can help, you help out with your business minds. It takes nothing from
Yeah.
you because this is something that is futuristic. It's something that is meant to last. In fact, I believe this is an initiative that Princess founded that is meant to even outlive her. She's planting a tree under whose shade she might not even sit. Your children will sit under that shade. So please dip your hand in your pockets. Pocket is deep, I know. Dip your hand in your pocket and bring out something. All right, so Princess, I still want to ask, as a woman building AfriGenetry, we've already discussed about the challenges women face, but now we want to like focus on AfriGenetry. What challenges and motivations have shaped your leadership journey?
Okay. I think I'm going to start with challenges before I move to motivation. I have mentioned few challenges, limited funding, partnership, and but building something like AfriGenetry Link required persistence and patience. Why? Because many of the conversations we are having about DNA, ancestry, preventive health are new communities. Even though uh, come to a place where we talk about DNA. We have so many researchers, genomic researchers here and there in Africa in the last 5 years. It's still a new space, especially in the heart of our community. Someone that can break it down, in pieces in a way the community will understand. So, and when we talk about DNA, a lot of people focus their focus majorly on paternity. Not on health. We have that. We have ancestry. We have health. We also have healing. When we talk about DNA, that's what you are bringing together in DNA as a tool. So because it's still a conversation and people, we are trying to create the awareness, educate, screening and lifestyle. Uh, a little bit to and with limited support, funding and support here and there, it can be challenging. But when you talk about motivation, for me, learning is every time someone so many stories, we have so many testimonies in this organization about people learning about their heritage and health. When someone learns about this, it helps me so much. It reminds me of why we do this. My passion for, and to empower communities, to empower the Black communities, to connect people together, to connect not only when it comes to ancestry, but also to remind their health. It motivates me so. And representation in genomic space to my heart because I said it in one of my videos. Here in the US, when I had there was a position we had medication, and the doctor gave us medication to the line on the wound. We did for 5 days, nothing worked. Instead of the problem increased. I went back to the doctor and I told the doctor, um, and one person said, "Is he African American?" I can't forget this. The one that was talking to me, that's his primary health doctor said, physician said yes. And the one inside said, but the medication does not work on them, meaning the medication does not work on African Americans. So I was
Wow.
like, why then? Why will you give it to me? If it's something that would have killed this guy by now, the guy would have been dead. And people will blame me for being less or what. So it means that because our data is not out, we are not included in clinical trials. So the decision, a lot of decision does, and I can't blame them because data is not out there. Even though us being the highest genetic diversity people in the world, we still have limited data out there. And because of that, it affects us so much. And we are trying to, include that. When we talk about deaths here and there, um, when it comes to disease deaths, cancer, this and that, the world, is it WHO or this said in 2020, in 2030 is going to, we have 45 million people, um, which roughly about to 75%, and it's going to be 95% or even more death. And that through awareness, early screening. They said early screening save life, early detection save lives, and lifestyle is going to reduce drastically when we come to people, communities. That's why I said we are community genetic counselors and genealogists, community based. That's what we are. And when we talk about come to where people can understand us, educate people language they understand, we will reduce the death they propose to happen from now to 2030. And that's my motivation. So I believe that leadership begins with purpose, and that purpose motivates more.
Wow. Thanks so much for that insight. It's really powerful. I'm sure we'll be guided by that and keep us going. Now, we are still in the month of women. We are celebrating women strength at home. So we are narrowing it down to black women all over the world. What wisdom can you share with them about their role in shaping or leading the future of heritage?
So I will just stop with this that women, are the ones who pass down stories, values, health knowledge, bias. Women influence health decisions. Women transmit cultural identity. Women lead community change. We are all, and when women understand their heritage, their health, they don't just change lives. They change the trajectory of their families, their communities, their nation. And when women heal as well, the healing transmits in all aspects of society. So that's why women need in every aspect. They need peace. Because if they don't, everybody around them will not have peace. So whatever you can do to empower a woman today, please do, because empowering women is one of the fastest ways to transform the world, to transform public health, and to transform the future generation to come.
Oh, interesting. That's very interesting. Okay, so we've already had it all. We've already had it all. It has been quite a blast today. I've learned
Yeah,
a whole lot. And I'm pretty sure
thank you.
everyone streaming in to have learned a whole lot from this session. Prior to now, when we hear about DNA, everybody's mind goes to paternity fraud. In Africa, I always think of paternity fraud as a find that that's a whole lot.
Yes. But as I said, we have one of the initiative of Gen Africa is free DNA pop-up event. I know how DNA is, quite expensive in Africa as a whole. So we are coming. I don't mention the first country we are coming to, but we'll be coming to, our for the community event that is for ancestry initiative, genetic initiative for free DNA test. Um, and this is a way to also discover your roots, know who you are. Um, if you are part of that, if it belongs to that family, not. And also, while knowing your ancestry, you're also discovering your health risk. So even if you don't know your dad, your mom, or whatever, you can easily through the DNA test know the kind of things or diseases that runs in your family, the risk you have. And also, we are there to help you on how you can manage it if you already have it, or how you can prevent it if you don't have it.
Oh wow. We look forward to that time. We are really, in fact, we are counting down. We are counting. We are checking our calendars from time to time. We really need to know. Who knows? Maybe I'll run the test. Because people that from Jamaica, I and I, it's very
Yes,
possible.
yes,
It's
yes,
never.
of course.
All right. Thanks, Princess. Thank you so much.
So
Thanks.
for having me.
It's
Thank you.
really been a wonderful. To our audience, if you want to connect with Princess and AfriGenetry link, you see their details boldly displayed on the screen. Try to connect and see how you can partner with them, not just today. Yes, she's giving today. You do that very well. At least the best anything you can do, anybody can do is to help you know who you are. So please support the initiative. You can reach out to her if you have questions to ask the organization. You do well to do that. And if you want to sponsor, yeah, please. But you can never be tired of seeking for sponsors, right? Sponsorship is very important. Where initiatives like this are concerned. So you know what to do. You can drop your investment. Okay, so this is how we want to draw the curtains close for today's life. And we are thanking you viewers for streaming in. Indeed,
Thank you,
remember,
guys.
don't celebrating and promoting our amazing African women here at home and out there in the diaspora. All through this month of March, we are still in the business of celebrating. So, as you can already see displaying on the screen, down below, try to follow us on any social media platforms that is best preferred for you as well, so that you can be updated on our weekly activities. We have other things we do aside from going live. So don't forget to subscribe to our YouTube channel and hit the notification button so as not to miss out on more inspiring weekly series like this already lined up for your viewing pleasure and of course your learning pleasure. So, oh, we promised 3,600 seconds and we've gone way above 3,600 seconds. So we are sorry that we are not sorry because we don't give you something that's going to help you in life. All the same, we thank you for tuning in and for staying with us down to this moment. Right? So thank you, Princess, again for
Thank you so
showing up.
much. Thank you for having me. Thank you.
We enjoyed you all through this session, giving us something to learn, something to think about. I promise we're going to work. We are all works in progress. So we want to see more progress. That is the progress. On behalf of African women, we are going to work on this. And wherever we need your support or where you want to give more support, please don't fail to reach out. And that's it, everyone. Thank you. Thank you so much for tuning in. I will not wait to matter any further. So,
Oh my gosh.